Welcome to Excellence in Peer Review Tina and Francis Training Network. This module will cover the topic of assessing biomedical article. After completing this module, you will understand what perspective you should consider when assessing a biomedical article and how to assess different types of biomedical articles. For biomedical articles, the basic principle of peer review apply in terms of what to consider and assess in each section. In addition, there are some other aspects you should pay special attention to. Consider whether the research has been conducted in an ethical and responsible manner. Have the author followed the best practice in protecting patients' anonymity and confidentiality? Have the authors include all essential details which are necessary to reproduce the research? Is there any potential bias or conflict of interest which could affect the study? For clinical study, consider disease progression and clinical impact when assessing research. For example, is the follow-up of patients long enough for an effect to be seen? Is it long enough for any potential negative impact of treatments to be assessed? In addition, all Tina and Francis medicine, biomedicine, and related journals require authors follow guidelines from the International Committee of Medical Journal Editors. As a reviewer, you could also refer to these recommendations. Another recommended tool for reviewing biomedical articles are reporting guidelines, which are compiled by the Equator Network. This provides checklists of points which are essential when reporting biomedical research, with different guidelines depending on the type of the study design. On one hand, these guidelines are helpful for authors in preparing and writing their articles. Some journals may require the authors to provide the completed checklist for a submitted paper, indicating when each checklist items have been addressed. On the other hand, reporting guidelines are also helpful for reviewers. It's good practice for a reviewer to examine the checklist, if provided, to ensure that all items have been adequately addressed. In order to be published in a Tina and Francis journal, all clinical trials must have been registered and in a public repository at the beginning of the research process. So the research aims and methods are recorded before starting. When reviewing, you can check the registration and the details which the authors have shared. If you have any concerns that the trial being reported is not the same as the one registered, or that there have been any changes which could affect the final data analysis, then you can let the journal know or include this in your report. Systematic reviews and meta-analysis are based on existing literature and use defined methods to perform a thorough literature search and critical appraisal of individual studies. A meta-analysis will also perform additional analysis of data from multiple previous published studies. As a reviewer, you can refer to the PRESMAR checklist if you need more guidance on what authors should include. When reviewing this type of articles, you should focus on the search strategy and the specific methodology the authors used to systematically assess and synthesize previous research. You should also pay particular attention to inclusion and exclusion criteria the authors claimed for literature search. Are they clearly described? You should consider the citation as sufficient if all relevant published studies are included, and also consider if the authors have selectively reported the study outcome. A randomized controlled trial tests the effectiveness of new treatments by randomly allocated subjects to groups. You can refer to the consult checklist when you are reviewing. You should pay attention to whether the reporting is consistent with the registration of the clinical trial. You should also check if the methodology of randomization is appropriate and all essential details are included so that it's clear that the author have done in the study. Pay attention to the setup of the control groups. Are the correct controls included? You should also pay attention to whether the author have emphasized positive outcomes. Results should be reported in a balanced manner. A case report describes the clinical progression of specific case. Cases are usually reporting an unusual or unknown disease, a novel drug reaction, or reporting differential diagnosis or misdiagnosis. As a reviewer, you can use the care checklist as a reference. You should pay attention to whether the diagnosis, treatment, and outcome are clearly described. Does the diagnosis appear to be correct? Was the treatment reasonable for the diagnosis? You should also consider if the case is rare or being reported before and what the case adds to knowledge. Thank you for watching this video. To find more training module, please visit our website.